Hi there, this is Dr. Ajaya Kashyap and we'll be talking about breast lift procedures today. There are several questions that have been frequently asked about breast lift. I'll be trying to answer most of them today, but you can always send us your questions and we'll be glad to answer them offline. What kind of breast lift leaves minimal scars? That is the first and a very common question that people ask me because the last thing people need is a lot of scarring of their breasts. So breast lift procedures can actually be divided into short scar breast lift, minimal scar breast lift, and the regular breast lift scars. The shortest scar that you can get is the one around the nipple, areola complex, which is the brown part around the nipple. The areola is the brown part around the nipple, and the shortest incision you can get is a circular cut just around the areola. The unfortunate thing is that this does not give you a lot of lift, and there is a chance of the areola itself getting wider with time. However, for people who need only a little bit of a lift, this is a good procedure. There is a kind of a different kind of suturing that is done there, and that aims to keep the areola at the same smaller level, so it decreases the size of the areola as well. The second kind of incision that we do is a vertical scar incision. So it is more like a lollipop, the round around the areola, and then a vertical scar down there. This incision has been popularized by Dr. Madeline Lejour and by Dr. Elizabeth Hall-Finley. And these vertical incisions tend to do very well. They become kind of silvery with time. They thin out a little bit. Very few of them ever get hypertrophic or thick. And if they do, they can be dealt with very easily. Most often they become thin and become very, very light. Now, the advantage of this kind of lift, besides the small incision, is the way it is done, the entire breast goes up. Even the inframammary fold or the fold of the breast lifts up by about 4 to 6 centimeters. So the entire breast goes up. The nipple areola complex, of course, goes up as with any breast lift incision. And the tissues of around the breast, which is the parenchyma, that is also lifted up. So it gives excellent long-lasting results and minimal scarring. The other incision that we use is like an anchor-shaped incision or a vise pattern where you have a cut around the nipple areola complex, a vertical scar, and then a long scar in the crease of the breast. The advantage of this incision is it preserves the vascularity or the blood supply of the nipple areola complex, especially in the breasts which have the circulation compromise, or where the breasts are very low, where a lot of lift has to be done. Many centimeters have to be lifted. There the circulation can be compromised if we do other kinds of breast lift procedures. So the incision is kind of long, but the circulation is preserved, and the nerve supply and sensation is also usually well preserved with this. So those are the common incisions that we use. Rarely we do non-surgical lifts also, or lifts where we do just a little semicircular incision in the top part of the nipple. So those also can do some breast lifts. We sometimes use invasive radiofrequency like Thermi-Breast to lift the breast up, and you can get about 1.5 centimeters lift with that procedure. And also you can get some shrinking of the areola. How long before I can return to normal activity is another question I've been asked. Now, in terms of desk work, you can actually start doing desk work in 5-6 days. You don't have to wait for too long. Most normal activities can be done in 2 weeks, heavy lifting in about 6 weeks. Also, excessive handling of the breast has to be avoided for a couple of months. What kind of appearance I would have after having the procedure? Is there a way of pre-operatively assessing it or judging it or being able to see what I would look like after the procedure? This is a question that I've been asked often. And although we show people pictures that are before and after, people specifically want to see how they would look like. And for that, we have an imaging system from Cosmetic, and that works well. There are other imaging systems as well, but this one I found to be especially useful. You lift the breast up on a 3D picture. People can get a good estimate as to what they're going to look like afterwards. Will a breast lift make my breast larger or smaller? Now, breast lifts do not actually change the size of the breast. However, when people have a lot of loose skin, that skin will be removed. A lot of the skin will be removed, and that can decrease the amount of bulk that the skin was occupying. Also, when the breast sits higher up, it looks more rounded and more firm. That can also change the appearance of the size of the breast, although we don't really change the size, as I said. How do I know I need a breast lift? Well, it is not a need, it is a want, a choice, and usually people who find that their breasts kind of are lower down than they would like it to be are good candidates. But a rough idea as to when people uh, often want it is when the nipple areola complex is lower than the inframammary fold or the fold of the breast. That dictates the degrees of ptosis or the breast droop or drooping of the breast. So if the nipple areola complex is below the inframammary fold of the breast, that is stage one, and then it keeps going on till you see the lowermost part of the breast above the nipple. So the nipple kind of tucks inside. So that is the last stage where you don't even see the nipple from the front. So depending on the degree of ptosis or the droop, one can decide if they want to have it. Again, it is a want, it is not a need. Unlike breast reduction, when you do breast reduction and lift with it, that is often a need because people have pain in their shoulders and in their neck and in their chest. So that often becomes a need. But breast lift itself is almost always a want, not a need. Can you get a breast lift without scars? Well, you can get non-surgical breast lifts, which are usually with invasive radiofrequency and sometimes with addition of some volume, some autologous fat from the patient's own body in the upper part of the breast. Those do give a good result, but to a limited extent, and one has to be carefully selected for this procedure. People who get these procedures and are good candidates for these procedures are usually very happy because there are no cuts and they do get the desired shape of the breast. But people who have a lot of ptosis or droop, they are not good candidates for these procedures. If I lose weight, will my breast become saggy? Well, like all tissues, once you lose weight, tissues tend to become loose and a little bit saggy. The same thing will happen with the breasts, but it would be less than if it would have happened if you had never had this procedure done. So the fact that you want to lose a few kilos should not be, or pounds, should not be a contraindication to getting this procedure done. However, if you are sure you want to have them done and you are sure you want to have weight loss, then by all means do your weight loss first so that you can get the best possible result with your breast lift procedure. All right. As I said, ideally they should be done when you are at your comfortable body weight, when you are not going to gain or lose too much weight, and you'll have a long-lasting, durable result. If my breast is asymmetric, should I go for breast lift or some other procedure? If your breast is asymmetric, when one side is much bigger than the other or much droopier than the other, then a combination of procedures like a breast lift with a reduction on one side or a breast lift with an augmentation on the other side can be a good choice. Very often there would be a slight difference in the symmetry and the size, and that's absolutely normal. That does not mean you need a different procedure or an additional procedure. But the difference is, if the difference is obvious, then one should think of a second procedure or combine the two procedures. These are the common questions that have been asked, but if you have any other questions, please free to contact us through one of our phone numbers or our website or email, and we'll be glad to answer them offline. Thank you and have a nice day.